So originally I went to undergrad at Cal State Northridge in Southern California, and then I went to grad school at USC. After USC, I discovered my passion in surgery. I was fortunate enough to get into a prestigious residency at LSU Trauma Hospital. So I discovered my passion in cosmetic surgery around 4th and 5th year of residency. That was the time where I discovered that I enjoyed working with the cosmetic patients and aesthetic patients more so than the other aspects. I enjoyed the technical aspects of aesthetic surgery. After medical school, we were fortunate enough to get into a really good trauma surgery program where I went on and attained my certification in general anesthesia. So I'm able to be fortunate enough to understand the entire surgical procedure from both sides of the curtain, both anesthesia and surgery. After residency, I was able to get into a fellowship dedicated solely to facial and body cosmetic surgery in Southern California. During that time, we learned how to approach cosmetic surgery patients because they are unique compared to some of the other patients we took care of in residency. We were able to approach patients comprehensively through consultations, surgery, post-operatively, evaluate patients, and also take care of complications, because at the end of the day, that's what's most important whenever you're providing cosmetic surgical care for patients. You want to be able to take care of complications as well. What sets a fellowship-trained cosmetic surgeon apart from someone who did not attain a fellowship and board certification is that you're able to see the full picture. A lot of people that are reviewing and looking for surgeons online are researching if they are board certified. And one of the biggest questions I get is, what is a board certification? Can you operate without board certification? And the reality is actually about 25% of surgeons out there are not board certified. And it's not an absolute must, but it is a level of prestige. You do sit through a fairly rigorous exam, both clinically and you have to submit documents to show that you have experience in these procedures as well. And you're evaluated in front of your peers. And a lot of these surgeons have done this for 25, 30 years, and so it's not that easy to go through the process. So I do believe it is safer for our patients if you are board certified, because it shows that your peers have walked you through what is the standard of care if you do have complications. You have a broader understanding of what the community is going through in treating their patients as well. I actually believe in the process of standardization and board certification so much that I chose to become dual board certified. I think one of the nice things here at Modern Surgical Arts is that I personally live a few blocks away. The hospital that I have privileges at is a few blocks away as well. And our surgery center is right within the facility. And I'm always accessible to my patients, and I take pride in that. I feel like these procedures are totally elective. Patients don't have to be here for any reason. They want to be here, and so do I. And both surgeons, myself and my partner, we take pride in that. And I think it's important to offer patients that accessibility to your surgeon. We're a text message away, we're a phone call away. And at the end of the day, our patients choose us because we put our patients' safety, their care, and their needs before anything else. One thing that we pride ourselves on here at Modern Surgical Arts is our 3 golden pillars. And that's great customer service, whether it's on the phone, the front office, all the way back to the clinic, myself and the patient coordinator. The second thing is doing good work. We strive ourselves in results. In cosmetic surgery, it's all about delivering the best results you can at any cost. And third is creating movement. And we achieve that through promotions, group events. At the end of the day, I don't have to do cosmetic surgery. I genuinely do it because I enjoy it, and I wouldn't do anything else.